Yes.
Yes. So the first question was, why do I have consistent UTIs despite being really clean? Now, this was one person asking me that. I have 9 other questions for you. Doctor, can you kindly teach us briefly about UTIs? Are they sexually transmitted? How can we avoid them? Treatment, but some people are self-medicating, and others are blaming their partners. Yes, I understand sexual activity can bring about UTIs, but people, I think, need to understand that it's not sexually transmitted, because men are always here telling me, can you tell her I didn't give her the UTI? And I'm like, okay, I'll get someone to help us understand it.
Yeah.
Yes.
Actually, viewers, assalamu alaikum wa rahmatullahi wa barakatuh. Chef has really introduced me very well. My name is Neema.
Not Neema.
Yes. Yeah, I'm a gynecologist.
Yeah.
I'm honored to be here to answer a few questions.
Yes.
I'm really not surprised that that is a question that is happening to be number one, because that's one of the challenges that we are facing out there in clinic as we are treating patients.
Right.
Everybody who enters the office comes in telling you, I have a UTI.
Oh.
Personally, I don't like the statement.
Okay.
I don't know who taught people that everything that happens down in the vagina and the private parts is a UTI.
Okay.
Actually, on many occasions, my clients have realized that I ask them,
Yes.
before you give me the diagnosis of a UTI,
Yes.
what is your problem?
Right.
Because that's where confusion comes in from.
Okay.
A UTI, if you have it in full, it's a urinary tract infection.
Okay.
We have a lot of things going on in our bodies.
All right.
The pelvis has the urinary tract system.
All right.
We have the sexual reproductive system.
All right.
They are lying in the same place.
All right.
Those systems all can be sick.
Okay.
The urinary tract system involves the urethra, where urine comes out from, the urinary bladder that stores the urine, the ureters, and the kidneys where the urine starts from. That is the urinary tract system.
Wow.
Then we have the reproductive system, which involves the ovaries, the tubes, the uterus, the cervix, come down to the vulva, to the vagina.
Right.
But they're lying in the same place.
Okay.
But they both fall sick in different ways.
All right.
The way you can get a headache
Yeah.
is the way you can fall sick. You're like, oh my God, my vagina is itching.
So I have a UTI.
Then you say, I have a UTI. No, vagina itching is different from having pain when you're passing urine.
Right.
You understand?
Right.
Now, these are two different systems.
Yes.
In the vagina is itching. Now we've gone to the reproductive system.
Oh yeah.
You understand what I'm talking about?
Yes.
When you're feeling pain while passing urine, now we are in the urinary, tract system. And a patient will come in and tell you, I have a UTI when they're having itching.
Oh yes.
I have a UTI when they're having a discharge.
And now that's a different system we are
You
talking
understand?
about
Yeah.
altogether.
Now, when you
right?
talk about the discharge is the reproductive system.
Okay.
When you're talking about painful urination, when you're passing urine, you're feeling pain. You're feeling every time you want to go for a short call.
Right.
That is now a urinary tract system.
Okay.
Then we have issues of low abdominal pains.
Okay.
Those pains can be because of your urinary tract system or your reproductive system. Sometimes you can feel pain in the lower abdomen because you're going to have your peas.
Oh wow. Okay.
Or you're ovulating. But when someone comes in with that pain in the abdomen, they're like, I have a UTI, because they're feeling low abdominal pain.
You know, when you explain it that way, now you're giving us something to think about. There is the urinary tract system and then the reproductive system. Now, that is way far our understanding, because during my sex therapy sessions, you realize that when you're talking about a vagina, the woman doesn't even know what a vagina is. And we're adults. She's in her 30s, she's in her 40s, and she's like, you mean my outer part, the labia and everything? They don't understand the difference between a vulva and a vagina. And as I speak, I would like to tell you that there are people who are watching who still don't know the difference between the two. So we're here explaining the urinary tract system. People don't even know where the vulva is or where the vagina is. So they mix the two. And that is the biggest problem we have here. Such topics are very, very sensitive, right? And I like how you've explained it, that if you're going to talk about a UTI, how does that feel like, right? What are the symptoms? What are the signs? And what causes it? And then for treatment, I always put a disclaimer whenever I'm talking about UTIs or anything sexual. I'm always like, please go visit a gynecologist. I am not a doctor, so I might have a little bit of knowledge, but go visit a gynecologist. So I'm glad I have you here. I would like for the people who are struggling with recurrent UTIs, what causes that? Like, I take an antibiotic today, 2 weeks later, same thing. I take an antibiotic this month, next month I have a UTI again. Why the recurrent UTIs? What causes that?
It also depends. Actually, as I said, that the urinary tract system is different.
Yes, please.
Your symptoms will tell you what you're having, first and foremost. If you're having painful urination, when you're passing urine, you're feeling pain, probably that's in the urinary tract system.
Okay.
If you're having discharge and itching, that is now the reproductive system.
That's
But
the
we confuse all that.
Okay.
And we are not further helped by the people we visit for treatment. Every time you check into a clinic nearby, someone takes off your urine, and like all the time they'll tell you have an infection in your urine.
Okay.
And people get used to that. That the next time they have the same symptoms, or they feel like it's like the previous exposure, they don't go ahead to seek care. They just go and buy treatment.
Oh, wow.
You understand?
Right.
So then they'll come up with a diagnosis, a chronic diagnosis of, I think I have a UTI every month. And now they're feeling certain symptoms, probably because, as I told you, sometimes you're ovulating and the lower abdomen is paining. Probably your urine has nothing
To do with it.
Yeah, but because you're ovulating, the egg has to come out. You'll feel some pain.
Yes.
Yeah. All your periods are coming. You're getting a little of premenstruation tension and pain.
Yeah.
You think, I felt the same last month and they treated me for
It should be
UTI.
a
So you check
UTI.
into the pharmacy and you treat for UTI. And as you're treating that so-called UTI as you think it is, that's why I said someone who's saying recurrent UTIs should give us a further description of what the symptoms are. Because what happens when you overtreat yourself, in Uganda we have a challenge of antibiotic abuse.
Thank you. Thank you.
We are abusing treatment, drugs, so much that someone walks up into one pharmacy, gets this. After 5 days, it's like, I'm not getting an improvement, goes to another pharmacy
Gets
and picks
another
another
one.
antibiotic. As you're